Hello everyone, I hope everybody is preparing very well for the upcoming NEET PG and FMGE 2024. Let's revise pharmacology in short with the past 5-year topics. This is Dr.Auoraj. Now let's quickly revise pharmacology in shorts. Now, remember, in general pharmacology, you're going to revise pharmacokinetics and pharmacodynamics. Kinetics, it is the effect of the body doing to the drug. Remember, in pharmacokinetics, it is the body, what it does to the drug. In pharmacodynamics, remember, D for the drug. It is the effect of the drug doing to the body and its mechanism. Very important to know the two terms meaning. Next, during the lecture, you might have probably studied a mnemonic for pharmacokinetics, which is going to be ADME. Yes. What is A for? A is for absorption, D is for distribution, M is for metabolization, and then E is for excretion. Maximum metabolization happens in the liver and excretion mostly happens in the kidney. Very good. During the examination, there were two questions asked. One was about fluoroquinolone with highest oral bioavailability is going to be levofloxacin, and second one was high plasma protein binding of the drug results in the decreased glomerular filtration. Right. Here, a little bit extra knowledge about metabolism. Remember, the main aim of metabolism is to make the drugs water soluble. Yes, and to make the drug also become what? Inactive. There are two phases which we have to know thoroughly for the exam. That is going to be phase 1, which is called as breaking phase, or phase 2, which is called as what? Conjugation phase. The mnemonic for breaking phase comes with the ORCD. O is for oxidation, R is for reduction, C is for cyclization, D is for decyclization, and H for hydrolysis. Now the conjugation phase, remember the mnemonic comes G, A, M, S, G square. Now first G is for glucuronic acid conjugation and second G is for glutathione conjugation. A is for acetylation, M is for methylation, S is for sulfation. Very good. There are two terms you have to remember, that is going to be enzyme inducing drugs and enzyme inhibiting drugs. The enzyme inducing drugs are going to be the anti-epileptics. We will discuss in detail very shortly about the anti-epileptics and the griseofulvin. The enzyme inhibiting drugs are going to be the antimicrobials and valproate. Good. Now, discussing about the excretion, as we have just studied that excretion mostly happens in the kidney via three processes, that is going to be glomerular filtration, tubular reabsorption and tubular secretion. Yes, they are going to follow two orders, that is going to be first order kinetic or zero order kinetics. For first order kinetics, remember with the mnemonic HC. HC is equal to what? Constant. Yes, HC is equal to constant. Now remember HC for high court also. Remember, most of the high court orders are always constant and most people do follow it. Similarly, for first order kinetics, HC, half-life and clearance are going to be what? They are going to be constant, and most of the drugs, they follow first order kinetics. Yes, and the rate of elimination is going to be directly proportional to plasma concentration. Now about zero order kinetics, remember, the rate of elimination is only going to be what? Constant. The half-life and clearance are going to be concerning with plasma concentration. Half-life is going to be directly proportional to plasma concentration and clearance is going to be indirectly proportional to the plasma concentration. Most important to remember is going to be the drugs following zero order kinetics. They come with the mnemonic ATPT. A is for alcohol, another A is for aspirin, and T is for theophylline, P is for phenton, another T is for tolbutamide. Great. Remember, there were two questions asked on thiazides and lithium. Thiazides increases the reabsorption of what? Lithium. Yes. For plasma level monitoring, lithium estimation is done 12 hours after the last dose. Please do remember. P for power of the drug. Efficacy is going to be the maximum response produced by the drug, and the slope is for safety of the drugs. In simple form, remember, when high potency is going to be something close to the curve, to the graph, and low potency is going to be little further away. Efficacy is going to be when the graph is little high, it may show us what? The maximum response produced by the drug. So this is going to have what? High efficacy, this is going to have high potency, and this is going to be low potency. Great. Now let's quickly look into the therapeutic drug index. Therapeutic drug index actually lies between the therapeutic effect and the toxic effect of the drug. Remember, this is going to be therapeutic index. Now TDM, therapeutic drug monitoring, is not required for antihypertensives, antidiabetics and anticoagulants. We will study all these drugs shortly as well. Now, drugs with narrow therapeutic index comes with the mnemonic TAALD, T-A-A-L-D. First T is going to be theophylline or tricyclic antidepressants. A is going to be antiarrhythmic, another A is going to be anti-epileptics, L is for lithium, and D is for digoxin. Great. Clinical trials are also one among the hot topics for pharmacology. Remember, there are phase 0, phase 1, phase 2, phase 3 and phase 4. Now, phase 0, as we all know, it is basically for the animals, done in animals. Phase 1, what do I have to remember in phase 1 is going to be the safety. It is going to be concerned with the safety of the patients, and number of patients are going to be less than 50. Please do remember this. Phase 2 is going to be focusing on the effectiveness of the drug, and the patient's number is going to be less than 100. Very important to remember as well. Phase 3, remember, it is going to look into the comparison of the drug. C, A, B, C. C is the third letter, phase 3. So comparison happens where? In stage 3, phase 3. In phase 4, remember, it is going to be looking into the post-marketing surveillance. A number of people are going to be thousands of people. Let's quickly revise. In phase 1, patients less than 50. Phase 2, less than 100. Phase 3, it is going to be thousands. And here, in phase 4, it is going to be more than thousands of people. This is called as what? Clinical trials. Please do revise. Very important topic for the main exam. Next, anti-epileptic drugs has been once again a very important topic for the exam. Now let's quickly revise the anti-epileptic drugs. First, for infantile spasm and West syndrome, what are you going to give? We are going to give adrenocorticotropic hormone or vigabatrin in case of tuberous sclerosis. The side effects could be what? Hypertension and fluid retention. Now for diabetic neuropathy, it could be gabapentin or pregabalin. For status epilepticus, we are going to give lorazepam. For focal seizure, it could be carbamazepine or phenytoin. For generalized tonic-clonic seizure, absence seizure and myoclonic seizure, we are going to give what? Valproate. Please do remember, it could cause hepatotoxicity, pancreatitis, and main important, it is contraindicated in pregnancy. Very important to remember. Next, anti-cancer drugs are also very important. Cancers are very common these days, and it has been simplified via the picture, which is going to be what? The chemo man. Yes, I hope everybody has practiced drawing chemo man. If not, please practice again so that you can remember maximum drugs. A is for what? Asparagine. C is for cisplatin. V is for vincristine and vinblastine. We have B for bleomycin. D is for doxorubicin. Psi is for cyclophosphamide, and M is for methotrexate. Please do practice. Now, what else do you have to remember in the anti-cancer drugs are going to be about the M phase inhibitor and the S phase inhibitor. M phase inhibitors are going to be vincristine and vinblastine. S phase inhibitors are folate inhibitor methotrexate, 6,8 mercaptopurine inhibitor, and 5-fluorouracil, which is a pyramid inhibitor. What else do we have to remember, sir? We have to remember the taxone, which are going to be the paclitaxel and docetaxel. Very important. Revise all the anti-cancer drugs. Gout. Gout occurs when the urate crystal gets deposited in the joints. It may cause what? Inflammation and intense pain. Yes. What happens is, purines, when they get converted to hypoxanthine, xanthine, the plasma uric acid gets accumulated more, and therefore the urate crystals deposition occurs a lot, leading to a condition called as what? Gout. Gout is classified into acute gout and chronic gout. The treatment for acute gout is going to be NSAIDs plus the microbial inhibitor, which could be colchicine. For chronic gout, we are going to give a xanthine oxidase blocker. We are going to give xanthine oxidase blocker, which is a allopurinol. Yes, we are going to give allopurinol or febuxostat. In case of uricosuric drugs, we can give probenecid or losartan. Yeah, here is what. Here we are going to give probenecid. Great. Next, what are the challenges faced by the younger generation in the name of socialism? We get to drink a lot, we smoke a lot, and also people get more obese these days. So therefore, it is very important to also know what the anti-alcoholic drugs. As a doctor, you can also prescribe these drugs for those patients who are suffering from alcoholism. Now, remember, the anti-alcoholic drugs comes with a mnemonic called as NOTA. Very simplified, NOTA. N is for what? Naltrexone. O is for onramycin. T is for topiramate, and another A is for acamprosate. The anti-smoking drugs are going to be varnicillin, nicotinamide, and buprenorphine. Next, we have the anti-obesity drugs. Look at this. This is what probably we are supposed to eat, but we enjoy eating more of these. The more we eat, the more the tummy is going to be bigger and bigger. Remember, and you are going to be lost in the situation. Now, the anti-obesity drugs comes with the mnemonic LOST. L is for lost, caserin, liraglutide, orlistat, sibutramine, and topiramate. Please remember the mnemonics NOTA and LOST. Yeah. The anticoagulant drugs are going to be very important for the exam as well. They are going to be heparin, warfarin, apixaban, and dabigatran. What is important to know about warfarin, sir? It is going to cause what? Fetal warfarin syndrome. Yes, very, very important for the exam. Fetal warfarin syndrome. It can lead to what? Nasal hypoplasia. It can lead to bone stiffening, mental retardation, and also respiratory distress. It could occur in case of what? With warfarin and coumadin. Now, let's look at the antiplatelet drugs. They are going to be aspirin and clopidogrel. Yeah, here we have aspirin tablets, and here we have what? Clopidogrel tablets as well. Next, glaucoma. Glaucoma is one among the common diseases of ophthalmology and a hot topic as well. Please do revise now so that this content can also help you during your ophthalmology preparation. Now, what is glaucoma, sir? It is when the intraocular pressure increases, IOP increases greater than or equal to 21 mmHg, or it could be visual field defects, or it could be also optic nerve damage or atrophy. Please do remember. Let's go. Increase IOP, visual field defect, and optic nerve damage. Yeah. Now, what is the main reason for glaucoma, sir? It could be because of what? Decreased aqueous production. Glaucoma could be because of what? Decrease in the aqueous production, or it could be because of also what? Increase in the outflow. Increase in the outflow. It could be either the trabecular outflow or the uveoscleral outflow. Very good. So now we have studied about glaucoma. It's now time to revise the drugs for glaucoma. Yeah, let's go. The ocular beta blockers. We all know the beta blockers ends with lol. Remember the ocular beta blockers as well. Now it could be timolol, bitoxolol, cartilol, or levobinolol. In case of carbonic anhydrase inhibitor, it is going to be acetazolamide, brinzolamide, or dorzolamide. Now, cholinergic drugs could be pilocarpine, physostigmine, or ecothiopate. And the prostaglandin analogs, remember, it starts with prost, so the drugs ends also luckily with prost. It is going to be latanoprost, vimatoprost, and tafluprost. Yeah, moving on to the next one. Mydriasis and miosis. What is mydriasis, sir? It is when the pupil gets dilated greater than 7 mm. Yes, please do remember. This condition is called as mydriasis. What we are going to give? We are going to give cyclopentolate and tropicamide. Yes, here we have tropicamide. In case of meiosis, what is meiosis, sir? It is the constriction of the pupil less than 2 mm. Yes, For meiosis, you are going to give two drugs. It's going to be either pilocarpine or physostigmine. Now let's move on to the serious topics. In serious, chronic congestive heart failure has been asked in the exam previously. Let's concentrate on it. What is congestive heart failure, sir? It is when the patient presenting to you would have rapid or irregular heart rates. There could be shortness of breath, swelling of the legs, and also swelling of the feet. We are going to give diuretics, venodilators or arterial dilators. Yeah, in diuretics we are going to give loop diuretics. For venodilators we are going to give nitrates. In arterial dilators we are going to give hydralazine, ACE inhibitors or sodium nitroprusside. Another important drug we are going to talk is going to be about mannitol. It is an osmotic diuretic, mannitol. Now, where can mannitol be used, sir? Could be used in the case of acute congestive glaucoma, cerebral edema, or also in case of pre-renal failure stage, and also to resist the diuretics. Great. Antihypertensives. Hypertension is one of the major concerns in India. WHO has recently announced that India has 220 million hypertensive patients in the country. So I presume there could be one of your neighbor or a family member who has been probably suffering, and you would have heard your friends or neighbors taking these drugs. What are the drugs? There is going to be the following ones. Let's see one by one. The antihypertensive comes with the mnemonic A, B, C, D. Very easy to remember. Let's look into the 3 A's. The first A could be what? ACE inhibitors, ARBs and alpha blockers. What are the ACE inhibitors, sir? They end with the mnemonic pril. It could be lisinopril, enalapril or captoprils. ARBs ends with sartan. It is going to be losartan, valsartan or telmisartan. Probably you would have heard these. Next we have the alpha blockers, which is going to be prazosin, doxazosine or tazobactam. Great. Now the beta blockers, as we all know, it ends with lol. It could be timolol, labetalol, cardiolol or metoprolol. We have the calcium channel blockers, which ends with the dipins. They are going to be amlodipine, nicardipine or nifedipines. We have the diuretics, which will end with IDE, that is going to be furosemide or hydrochlorothiazide. Now, why is hypertension a major concern, sir? It could lead to what? Depression. It could lead to anxiety as well, heart disease, sexual problems, stroke, loss of visions, and also kidney diseases. Hypertension, just a quick revision, remember it is when the diastolic is going to be greater than or equal to 140 mmHg and the systolic is going to be greater than or equal to 90 mmHg. Very important. Next, let's look into angina. Angina is a condition when the heart muscles temporarily gets lack of blood and oxygen, leading to severe pain. Yes. What is the drugs we are going to give? They are going to be the anti-anginal drugs. Starting with nitrates, we are going to be giving nitroglycerin, isosorbide, mononitrate or dinitrates. Yes, or we are going to give the calcium channel blockers, which are going to be the verapamil and diltiazem. We are going to give the beta blockers, propranolol or atenolol. We can either give potassium channel blockers, which is going to be nicorandil, or the miscellaneous drugs, which is going to be dipyramidol or aspirin. Yeah. Next, the adrenergic drugs are also a very important topic. Let's look into the easiest one, that is going to be bronchodilators. Remember, we all know salbutamol, we know terbutaline, salmetrol, formoterol and babitrols. Now, C and the stimulants, please remember, very important for the exam. They are going to be the amphetamines, dexamphetamine, methamphetamine and methylphenidate. Please remember the CNS stimulants. Next, the uterine relaxants are going to be ritonavir, isosuprene, salbutamol and terbutaline. The cardiac stimulants, very important, are going to be the adrenaline, isoprenaline and dobutamine. Nasal congestants, I think everybody knows this. This is going to be xylometazoline, oxymetazoline, nafazoline, we have phenylephrine, and then we have phenylpropanolamine, and then we have pseudoephedrine. Next, the anoretics are going to be the amphetamines, fenfluramine, dexfenfluramine and sibutramine. And at last but not the least, we have the pressure agents, which are going to be the noradrenaline, ephedrine, dopamine, phenylephrine, methoxamine and mefentamine. Great. Now let's quickly revise the drugs. What is this? This is going to be ethylene. In which group do they come? They are going to be coming under bronchodilators. Very good. I hope this can be seen. This is going to be adrenaline. In which group do they belong to? They belong to the cardiac stimulators. Very good. And here this is going to be methyl amphetamine. What is this? This is going to be a CNS stimulant. And what is this? Xylometazoline. Quick. This is going to be a nasal decongestant. Very good. Next, look into the anti-muscarinic drugs. There we have the natural, synthetic and semi-synthetic. In natural we have atropine and hyoscine. This is going to be commonly given for what? In case of motion sickness. We have semi-synthetic, which are going to be the atropine, omatropine and hyoscine. And we also have ipratropium and shiotropium. We have the mydriatics, which we just recently saw a few slides back. They are going to be cyclopentolate and tropicamide. We have the vasoselective ones. They are going to be oxybutynin, tolterodine. We have flavoxate. We have darifenazine, solifenazine, and tropsium. Remember with the mnemonic soft. Yes. Next, we have the anti-secretory drugs. They are going to be propathaline. We have oxyphenium, and then we have clidinium, and then we have glycopyrrolate. Remember at least glycopyrrolate. Next, the tertiary amines are going to be dicyclomine. We have valethamate, and then we have pyranzapine. Great. Last but not the least, very important, this is going to be Parkinsonism. They are going to be the drugs which is going to be given here is going to be trifexanidine. We have procyclidine, we have bipilin, and then benztropine. Yes, very important for the exam, anti-Parkinson drugs. Next, quickly revise the drugs of choice in one lines. Let's go. Supraventricular tachycardia. What is the drug give? It is going to be verapamil. Verapamil. Very good. For bradycardia, what we are going to give? We are going to give atropine. Yes. For androgenic alopecia, boys, I think you all know it. So that's going to be minoxidil. We have WPW syndrome, Wolff Parkinson White syndrome. What we are going to give? We are going to give K9. PSVT, we are going to give adenosine, supraventricular tachycardia, adenosine. In case of torsade de pointe, we are going to give magnesium. We are going to give magnesium. For cardiogenic shock, we are going to give dobutamine. And nephrogenic diabetes insipidus, we are going to give thiazides. Yes, this includes the most important drugs required to be revised for pharmacology. I wish you guys all the best. Keep updated with the upcoming videos, and we will revise all the subjects very soon. All the best.